This is Mayor Mike Callis, City of Portland. It's March 26, 2020. Gathered with you here this afternoon. I'm not sure what time it is. It's maybe after 4 o'clock or something.
4:30.
4:30, okay. And so I want to kind of catch you up. We do our counts that come from the Tennessee Health Department at 2 o'clock, and then we get on our Emergency Management Association calls. So for Sumner and for Robertson, and we get updated numbers even from the 2 o'clock release. And so I wanted to talk with you a little bit about that. Before I do, and so we have launched a new campaign countywide. This is from the health department. And so it's Stay Home Sumner. Just encourage you to do what you've been doing. Stay home. Only leave if it's essential. Let's not get out if we don't have to, and let's not gather in groups. Let's keep our gatherings very, very small, less than 10 people. And we want to encourage you, of course, to wash your hands, sanitize your home, sanitize your workplace, and just be very self-aware when you get out and go grocery shopping or to the pharmacy or whatever you do. We encourage folks, only touch the item that you're going to buy. And so, sometimes we're in the habit of picking up items and looking at them and setting them back on the shelf. Don't do that. Just pick up the item that you want. And that kind of helps us with any kind of cross-contamination and working through those things. So Stay Home Sumner, and we're encouraging you to do that as well. You've seen that on the City of Portland's Facebook page and some other pages, and this is being shared. You're going to see some signs around the community just to remind us. If you've noticed our LED sign up on 109 close to downtown, we're putting some messages up there to remind you of some of these things as well. Well, let me share with you a couple of some stats and things off of our calls. I just want to share with you. Robertson County is sitting at 20 confirmed cases. That's what was released off of the 2 o'clock data dump from the health department. And after speaking with them, they don't have any new numbers to add to that currently. Remember, these tests, there's multiple tests out, and unfortunately right now the testing's taking a while to get through. And so we personally know that some tests are sitting out there 6-7 days before we're getting results. And so we may have a whole batch to run through the facility, then we get all those numbers at once. It doesn't mean that overnight, simply because the numbers grew by a large amount, that everybody was tested positive simply in that last 24 hours. These are tests that are in the queue and are waiting to get results. I'll give you an idea. And so at 2 o'clock, they released 957 total for the state of Tennessee, but actually the number as of this afternoon is 1,098. And so we can see these numbers are coming at different times. It looks like the amount of testing being done versus the amount of positives in our state is still remaining about the same level percentage-wise. I think these numbers that was released at 2 o'clock is 6.4% positive rate to the amount of tests being done. Spoke with our friends over in Robertson County, seeing how they're doing, seeing how they're handling the emergencies. They're dealing with PPE issues as well, just like many of the agencies around the country are having issues with the number of gowns and gloves and masks and even the boot covers to put around your shoes, so we're not tracking things in and out and carrying a virus around with us. So this continues to be an issue. We're starting to see some manufacturing come online, even locally, to start making some of these gowns. We just heard a report today about a company going to start making some gowns. And so that's good news for us. Our friends in Robertson County at Northcrest Hospital, they said if they had to, this is an emergency case scenario, this would mean that beds would be sitting in the hallway and things of that nature. They could hold up to 120 beds at Northcrest Hospital. Currently, they're still operating at basically normal percentage rates, and so about right now they have about 45 beds that are being utilized. Now, what the problem with COVID-19 is, because it's a respiratory issue, is that they only have about 8 regular respirator-style beds there. They can push that up, they think, to 14 to 16 with some alternative methods to kind of make that happen if they had to. Of course, we hope that it never gets to that. So it's kind of, I like to look at the bed count for hospitals. It lets me know what's going on in our area. They just cleared out their ICU patients today. And so, we're seeing these come online and leave, and so that's a good thing to see. It's a good thing to see people recover and do that. So talking about bed count, I shared with you yesterday that they've come and surveyed the Portland Hospital. It appears there that if they needed the space and they had to push it in an emergency scenario, they could do up to 60 beds at Portland. That's good news for us to hear those things. In a push come to shove scenario at Hendersonville, they could do up to 216 beds. Their normal bed count's 126 that they kind of operate on. Right now, they're only using 75 of those. And so pretty well staying in the percentages of normal use. Talking about the bed count at Sumner, their normal beds run around 125 up to 325. In a worst case scenario, they could have beds sitting in hallways and all that. And so they're sitting about 107. So they've got a few patients. They're waiting on some testing there to see how all of that shakes out. And so these things are kind of ongoing. So I want to kind of let you know about that. We'll talk about the numbers real quickly. Pardon me, I've got to go through my paperwork. I've made some little notes. As I said, the 2 o'clock data dump was 9:57 for Tennessee. You need to know about how that data is kind of put together. And so there's still, this is new. We're trying to figure out how to do data counts through a pandemic. And so everybody's kind of learning. And so they have some pending tests that are still out there, trying to nail that down, trying to ensure what the age counts and those things. Still today, the largest demographic of positive for COVID-19 is ages 21 to 30. And so right now on the 2 o'clock count, they were sitting at 260, but the total count for the state was 1,098. Davison has a new number for today, though the 2 o'clock count listed them at 203. They are at 293, and as I said, that doesn't mean that overnight they just had 90 new cases. There's some of these tests take days to come back because different testing facilities are trying to tighten that up and speed this up, which will be a big help to everybody. We're starting to see some counties that concerned us that wasn't showing any testing results are starting to come online because it didn't make a lot of sense to us. We'll talk about Hamilton County, as you would think of Chattanooga. They're up to 28 right now, so they're starting to see some of those case counts. Knox County, you kind of figure their numbers will be considerably higher. They're only sitting at 26 currently. We go down the list a little bit. Montgomery County still sitting at 6. Doesn't make any sense to us. Rutherford's at 27. And then Robertson, as I said, is sitting at 20 cases. And then for Sumner County, the 2 o'clock data dump today was 43, yet we had confirmation yesterday evening when I shared with you it was 44. Well, the confirmation number we have today is 55. And so, once again, it's the test and how long they're out there. We know for a fact that there's some individuals that's waited more than 6 days to get results. And I know that can be difficult, but these are the things we have to look at. And so we have out of that total number that they listed out of the 2 o'clock of 957, 117 of them were out of Tennessee. Their residents may have been in Tennessee, but it's my understanding they were somewhere else out of the state when they tested positive. So, while that adds to the number, it's my understanding they were not in the state when they got tested. Remember, all of the tests refer back to your residence. And so you could get tested positive in a hospital in Davison County, but if you live in Franklin, Kentucky, that's where it will tag you to. That's our understanding of that. So just wanted to take a little moment to kind of share some of that data with you. I just seen before I come over here, it's breaking on the news about a nursing facility, I believe, in our county that's having some difficulty. We've heard reports of others. We want to be mindful of that. We know that can easily spread and cause some serious damage to folks that maybe have a weakened immune system. That's why we're asking you to stay at home. Stay at home Sumner if at all possible. We understand that there's a lot of essential work going on, that everybody can't stay at home. We get that. But we want you, if possible, to stay at home and not allow your children to go house to house. You don't go house to house. You know, our parks facilities are closed, so we can limit the gathering of people. We're making some changes here locally as well. On Wednesdays, the business office is closed to the public. While we still have employees working there, that gives us a break so we can rotate schedules and make sure that we're limiting the number of people in that building to less than 10 at any given time. That's our hope that we're trying to do. We're also going to be changing sanitation schedules in the city of Portland. We're encouraging you to have your trash can to the road by 6 a.m. on the day your trash is picked up and leave it there until they come and pick it up. It's kind of like a holiday schedule that you may be used to, but have it to the road by 6 a.m. They may get your trash can at 6 a.m. or they may get it the next day. And that allows us some freedom to schedule to make sure people are not in close confinement areas if we can keep from that. We have had some quarantine situations already in our employee base, so we're working through that. Of course, their health is of utmost concern for us. And so we're doing what the health department wants us to do and follow through on some of those things. So be careful, wash your hands, stay at home, and I will talk to you later.